Now that we have a lot of advancement in MRI, do we need a CT scan? If you are a referring doctor, you ask yourself, when do I refer for what? And you as a patient, they may advise you go for this or go for that, and you may not appreciate the strength of each one of them. So for today, we'll compare a CT scan and an MRI. My name is Dr. James Senoga. I am a senior consultant radiologist and teleradiologist, and also a lecturer with ECU. For today, we are going to look at other two modalities, that is comparing the CT scan and the MRI. A lot of you have been asking, now that we have a lot of advancement in MRI, do we need a CT scan? But probably before we go into the comparison, let's look at each one of them. You can see the patient being put into the CT scan. It is round like that, and it shows the patient's head goes in there, and inside there is an X-ray tube. So an X-ray tube goes round here. And of course, this it rotates round, able to produce a cross-sectional image, just like you see one there. With this cross-sectional image, then you can see quite a lot of detail. Of course, we also do the pre-contrast and the post-contrast study. So that's so much about the CT scan. It uses X-ray and it produces cross-sectional images. On the other hand, the MRI uses magnet. It uses magnet and a radio frequency. Just like you see on my screen, again, there are two types. We have the closed MRI and we have the open MRI. The closed MRI here, we are talking about a helium-cooled superconductor, which is in here and can be able to raise magnetism of 1.5 to 3 Teslas. And that it can enable us to do full examination like the spectroscopies and the MRCPs. This makes it a bit more expensive, not only to purchase, but also to run. Claustrophobia is one thing that this closed has the poses, and of course it is more prone to accident because of the high magnetism. But of course, images like the spectroscopy are ably done on a closed MRI. The open MRI, again, uses a permanent magnet. And of course, we are saying that this allows children, can allow those who are claustrophobic. However, because of the lower magnetism of about 0.3 to 0.5 Teslas, makes it a bit cheaper to install and to run, and of course it gives us a bit of short range of examination. Mainly the strength is on the brain, spine, and MSK, as we shall see later. Both these use the magnetism and the radio frequency. The physics of how the image is formed in the MRI is a little complex, and I might not want to bore you with it, but just quite easily put is it was discovered that that hydrogen atom in the water behaves like a bar magnet. Once you subject that hydrogen atom in water on a strong magnet, it aligns itself with that magnet. But again, when you subject that to a radio frequency, it bends down in 90 degrees. So if you pulse this radio frequency, this goes back. And as it goes back, it gives off energy. That energy it gives off helps us to generate the image, giving us a clue of these images, just like you see that where we have more free hydrogen atoms, the intensity is quite high, the signal intensity is quite high, and we shall see on a T2. So roughly that's how images are formed. We need a magnet, we need a radio frequency, and then we need a receptor whereby we generate images. The physics is really, really complex. each one has a strength and each one has a weakness. But broadly speaking, a CT scan uses X-ray, is quick, usually quick, less than a minute. Within seconds, the examination is over. But on the MRI, on the other side, it may take a bit of time. It could take about 30 to 45 minutes. Again, depends on how many sequences you are running, and also depends on the strength of the magnet. So you can imagine if a patient is very sick and has to stay still, because once the patient moves, we may not get the image. So if you have these sick patients and you want to acquire images rapidly, then you will need to use a CT scan. But of course, when you look at these ones here, for example, you want to study in detail the soft tissues, detailed images, you want to use an MRI. And like I already said, the CT scan is good in lungs, in angios, and in bones. Now, I'll quickly go through systematically to show you the strengths for those of you who are listening in and are medical doctors, may be interested in knowing when do I refer which patient for what examination. You as a patient may say, my doctor referred me for this examination, and you understand why. I'll look at the systems, the CNS. If you broadly look at the CNS, MRI does most of the work in the CNS. That's the central nervous system, except of course if you are dealing with bone and very sick patients. On the other hand, in the chest, in the lungs, again the CT scan plays a major role, especially when you're talking about the lungs, when you're talking about the angios, when you're talking about the bones, especially in trauma. You want to use a CT scan. But again, an MRI also here plays a role whereby you find that the tumors in the mediastinal tumors, the chest wall tumors, okay, these are very, very common. The abdomen, in the abdomen, the MRI plays a major role, especially because of the soft tissues. We're talking about staging, although you may also use a contrasted CT scan, which gives you the triphasic and the angios. The MSK, MRI for the joints, soft tissues of the joint, and the CT scans come in accidents. You know, when you have an accident, you have fractures, you need to reconstruct these bones, you need a CT scan. So quickly, in summary, that gives you a clue as to when to refer. Right now, I'll run through a few images and then to bring up these points a little bit more clearer. For example, shown on the screen there are some strong indications for a CT scan in the CNS. Okay, so if you are dealing with the central nervous system, emergencies and very sick patients, because of the rapidity of the examination, you will need a CT scan. Here in acute hematomas, like you see on the screen, they are best seen on CT scan. The MRI may not even show you these hematomas because of the signal void. So in less than 6 hours, a patient has fallen off a border, patient has had an accident, you need a CT scan, and then you can define hematomas. Like in that case, you can see this epidural hematoma, you can see this intracerebral hematoma, and of course this is a chronic subdural. A chronic subdural also, the MRI can come in. Yes. Now, the other strong indication for a CT scan in the CNS in the accident is when you have fractures. Fractures, you can reconstruct the image like you can see there in 3D, and if you're a neurosurgeon, you can get a good way as to how to reconstruct these bones. The base of skull fractures, again, and of course the vertebral fractures, you need a CT scan. Yes. The other indication for a CT scan is I told you about hemorrhage. You have again acute hematoma, and the management of these infarcts differs. Either it is ischemic or hemorrhagic. Now, for the hemorrhagic infarction, you will need a CT scan because it not only demonstrates the acute hemorrhage, but it shows you also other complications, like if it goes into the intraventricular, if you get intraventricular hemorrhage like you see in that image. When you are talking about the paranasal sinus, again, the detail in those paranasal sinus can only be achieved on a CT scan. So, in summary, again, the CT scan, the strength of the CT scan in emergencies is in the emergencies, in the acute hematomas and the basal skull fractures, and of course, the acute infarction. Quickly, the MRI again has strong indications, especially when now we are dealing with an ischemic. The other one was hemorrhagic infarction. Now this is ischemic. So if we are dealing with an ischemic type of infarction, the MRI plays a major role. If you can view with me on the screen, you can see that CT scan which is done maybe 6 hours after a patient comes in with symptoms, but it's below 6 hours, the CT scan is normally normal. So you see that part there does not show any evidence of change of density. But the MRI already shows something on the T2, but on more specific sequences like the diffusion weighted and the ADC mapping, even below 6 hours, one can be able to delineate the area which is affected there on the ADC mapping. Other sequences like the flare, like the fusion, the perfusion can also help in acute infarctions, ischemic infarctions. CT scan again, like you see, this is a follow-up probably after 24 hours. That's when you can see. So when you have an ischemic infarction, you want to use an MRI, and of course you want to ask for the diffusion weighted. Other conditions like the base of skull tumors, this MRI is quite handy, and it gives us not only the definition but helps us to look at the adjacent structures as well. Tumors, the close study of how much edema, if it takes up contrast. Again, MRI is superior. MRI is also superior in the spinal tumors, just like shown there, and also MRI is much superior in white matter diseases like multiple sclerosis. As you can see here, white matter diseases, you can be able to see that increase in density in a T1 weighted image there visualized. So by and large, if you want the rest of the condition, apart from the acute and the very sick patients, the rest of the condition you want to use an MRI. Most of the chest work is done by CT scan because of the air there, because of the bone, but MRI also has a role. Here in the lungs, we can use the high-resolution CT. Incidentally, many doctors do not appreciate the high-resolution CT. They tend to get this impression as though the high-resolution will show you more detail. Yet, we tend to use the high-resolution. So if you are a doctor, referring doctor, and you're not quite certain about it, you can even cross-check with us, ask with us. But high-resolution CT is usually for the lung parenchyma. We just dealt with COVID a few years ago, and then we are able to demonstrate it in the lung. The interstitial pulmonary lung diseases also are very well shown on CT scan. Needless to say, again, the trauma, where there's air in the subcutaneous, air in the pleural space, a CT scan comes in quite handy also to demonstrate the fractures of the ribs. The CT scan also is very handy in PE because of the rapidity of the test. We are able to do the angios and also the coronary angios. CT scan is more superior here. Of course, like I said, MRI, its strength is in the tumors, like shown here, the tumors, the mediastinal tumors, tumors of the wall, and tumors elsewhere. The MRI, because of their soft tissues, helps us to define the soft tissues better, if not best. When we go down to the abdomen, apart from the vascular, of course, the angio's and the traumatic, where you get organ trauma, fractures, and then the staging, most of the abdominal work is done by MRI, and this is when we can define the soft tissues even more clearer. The strengths, finally, as I'm winding up, the peripheral, here the peripheral, again, it's made up of the soft tissues and the bone eminence. For the bone detail, CT scan, like you can see there, CT scan, if you're looking at bone detail, you want to use a CT scan. Of course, it can also help us to reconstruct the complex fractures for those who are doing plastic surgery, so to know exactly how to place these bones, and of course also in the angios. But if you have conditions which involve the soft tissues, like for example here we're measuring the cartilaginous cap of osteochondroma, you need a T2 MRI, and of course here when you're talking about meniscal tears, tendon tears, you're talking about bone marrow edema, again MRI is superior than CT. So in trauma, in a nutshell, you may end up using both of them. The CT scan to define the bone fractures more clearer, and the MRI comes in with a definition of the soft tissues. Ladies and gentlemen, that in a nutshell, I hope it directed you and showed you how to navigate the CT scan and MRI terrain. If you are a referring doctor, you're asking yourself, where should I refer what? So in summary, if you have this patient and is very sick, the advice is, of course, use the CT scan. If you have an accident where you're expecting fresh blood, again, we encourage that you use a CT scan. If you have angios, of course, needless to say, you need a CT scan. But other examinations, the soft tissues, the brain, the abdomen, and all these, the MRI is superior. I would like to leave you with that, and I hope you have found it useful. If you have found this information that you have had educative, feel free to like and subscribe. Have a good day, and bye for now.